Bismillahirrahmanirrahim. Today we are going to learn about the blood supply to kidney and nephrons. This is a very short topic. In this topic, we will learn about the blood supply to kidney and nephrons. Uh, as previously, we have learned about the systemic circulation. In the systemic circulation, the aorta was responsible for the supply of blood to various organs. Uh, in the diagram, you can see that this main artery, this is the descending aorta. This is the descending aorta, and this descending aorta gave multiple branches. One of the branch which gave blood to the kidney, that branch is called renal artery. This is called renal artery, and this renal artery is responsible for the supply of blood to the kidney. Now this renal artery is further divided into many sub branches, which goes to the nephron eventually. um, but this artery, this renal artery, also gave some branches to some other parts of the kidney and some other parts of the some other organs also. For example, in this example, you can see this one. This is the branch of the renal artery. This is called inferior suprarenal artery. This inferior suprarenal artery is one of the artery which supply blood to the adrenal gland. This is the adrenal gland. Adrenal gland is not having only one blood vessel that supply blood to adrenal gland, just like many other organs. Adrenal glands, the main gland which is responsible for the supply of blood to the adrenal gland or suprarenal gland is this one. This is the inferior phrenic artery. Actually, this phrenic artery is mainly responsible for the supply of blood to the diaphragm. Above this area there is the diaphragm, so this phrenic artery supply blood to the diaphragm. But from this phrenic artery, multiple branches arise which give branches and which give blood supply to the adrenal gland. So the main artery which is responsible for blood supply to the adrenal gland is the inferior phrenic artery. Similarly, the middle suprarenal artery, these arteries are the only artery which only supply blood to the suprarenal gland. While this one, this artery, this is the branch of it. This is the branch of renal artery. The renal artery gave one branch which goes to the adrenal gland, and it's supply blood to the adrenal gland. This is called inferior suprarenal artery. So in this lecture we are going to learn about the blood supply to the kidney and nephron. That's why we are also learning about the renal artery, the branches of renal artery. So this was one of the branch of the renal artery which was going to supply blood to the adrenal gland. And similarly, this is the second branch of the renal artery. This gave blood to the capsule of the artery, or the renal capsule, the fibrous tissue, which surround and protect the this kidney. That is called renal capsule. Renal capsule is a fibrous layer which surround the kidney. That fibrous tissue, that fibrous layer will also need some blood for their regular function. That's why it's also have an artery which arises from the renal artery, and it give blood supply to the capsular. That give blood supply to the renal capsule, and that is called capsular artery. But actually, this you can see that this do not arise from the renal artery directly. This capsular artery do not arise directly from the renal artery. Rather, it arises from one of the branch of the renal artery. We are going to learn about in the next diagram. in this diagram, this is somewhat real. This is not real diagram, but this is somewhat real from the previous one. This is the descending aorta, and this one this is the descending aorta, and this descending aorta gave branch to the this is the renal artery, and this renal artery gave branch to the inferior suprarenal artery. This is the inferior suprarenal artery. This is the middle suprarenal artery, which rise directly from the aorta. Um, and over here, this is the renal artery. There is no capsular artery in this diagram. That will be in the next one. Yes, in this diagram, there is no capsular artery, but there is one other artery which also arises from the renal artery. This is the renal artery. This is the main renal artery that is responsible for this blood supply to the this one. This renal artery is responsible for the blood supply to the you should learn about these four types of tissues. That the renal artery is responsible for the blood supply to the kidney. This renal artery is also responsible for the blood supply to the ureter. This renal artery is also responsible for the blood supply to the adrenal gland. This renal artery is also responsible for the blood supply to the capsule. This is the capsule. This is the capsular. This is the renal capsule. So the renal artery is responsible for the four different types of tissues. Okay. This renal artery gave branch downward, which gave blood supply to the ureter. And that is called ureteric artery. This is called ureteric artery. This is ureteric artery. This is the branch of the main renal artery, and this renal artery further gave branches, and each branch of the renal artery which supply blood to the kidney is called segmental artery. Segmental artery is the direct branch of the renal artery. The direct branch of the renal artery is the segmental artery which gave blood supply to the kidney, to various segments of the kidney. Okay, and this segmental artery, in this diagram, I have also in this slide I have mentioned all the arteries. You should learn about this, that these 11 types of blood vessels should be learned in the blood supply to the kidney or blood supply to the nephron. And the first one is renal artery. This is the renal artery. This renal artery gave branch, that is the segmental artery. This one is segmental artery, which gave blood supply to the segment of the kidney. The third one is interlobal artery. Interlobar artery. This segmental artery gave branches. This branch of the segmental artery. These are the interlobar artery. The interlobar artery goes in between two pyramids. In between two pyramids, the interlobar artery always goes in between two renal pyramids. So this up to this portion is the interlobar artery. Up to this portion is the interlobar artery. These are the branches of interlobar artery. So the segmental artery gave branches to the interlobar artery. This is the interlobar artery. This one. This is also interlobar artery. This is also interlobar artery. Interlobar artery means the artery between the lobes of the kidney. Between the lobes of the kidney are the renal lobe. Between the renal lobe, I have already discussed about the renal lobe, which comprises of, each renal lobe comprises of one pyramid, overlying cortex, and adjacent renal column. So the artery which gave blood supply to the pyramid, to the overlying cortex, and adjacent renal column. So the lobar artery is the branch of segmental artery. The fourth one is the arcuate artery. The artery which is the branch of the lobar artery, which make an arc around the lobule, or which make an arc around the pyramid, around the base of pyramid. This is the arcuate artery. when the lower artery become arc shape, when the lower artery gave the shape of an arc, so this is called this is called arcuate artery. This is also arcuate artery. From this portion to this portion, this is arcuate artery. From this portion to this portion, this is interlobar artery. So the arcuate artery make an arc around the renal pyramid. The arcuate artery make an arc around the renal pyramid. So in the next diagram, you will see separately each and every one. So this is the renal artery. This is the inferior suprarenal artery, which we have learned in the first one. You can see in this one, this is segmental artery. This is segmental artery, but this segmental artery gave branch to the capsule, that is called capsular branch, capsular artery. This is actually the capsular artery. The capsular artery do not arise directly from the renal artery, as there was in the first diagram. In the second diagram, you can see not this one. Yes, this one. In the first diagram, this is the capsular artery. But the capsular artery, you can see over here that this is not the branch of the renal artery. This is the branch of segmental artery. So in this diagram, you can see that this is the capsular artery, which is the branch of segmental artery, and this segmental artery is further divided into the interlobar artery. This is the interlobar artery, this is the interlobar artery, and this interlobar artery further gave an arc shape. This is the arcuate artery. This is the arcuate artery. This is the arcuate artery. You can also see over here, this is an arcuate artery, which make an arc around the base of the pyramid. So the arcuate artery also gave some branches, and these branches are very significant in the blood supply of the kidney or nephron. That branch, you can see over here that this was the interlobar artery. This was the interlobar artery, and segmental artery gave branch to the lobar artery, interlobar, and this lobar artery gave branch of the arcuate artery, and this arcuate gave branches. These are the branches of the arcuate artery. These are the branches of arcuate artery. Large number of branches you can see over here. This one is going out also. So these arteries are called interlobular artery, interlobular artery, or interlobular artery. You can also call it interlobular artery. This is interlobular artery. So interlobular artery is very significant one. In this diagram, you can see this one. This is the arcuate artery, and this arcuate artery make an arc around the pyramid. This arcuate artery gave the branch. This is the interlobular artery. This is the interlobular artery, and the previous one, and this is the interlobular artery. This is the interlobular artery. This is the interlobular artery, and in this one, this is the interlobular artery. Okay. The diameter of interlobular artery is very small from the arcuate artery, but over here the arcuate artery and interlobular artery are having the same diameter. This is not true. This is just factious. In this diagram, you can see that the arcuate artery is having larger diameter than the interlobular artery. So the interlobular artery further gave branches. This gave branch. This is called efferent arteriole. From the interlobular artery onward, there is no artery, there is arteriole. So this is the efferent arteriole. This efferent arteriole goes inside the Bowman capsule of the nephron and make a structure inside the Bowman capsule, and this is a porous structure. This structure is called glomerulus. This is called glomerulus. Glomerulus is one of the structure of the arteriole. This is one of the structure of the arteriole. This efferent arteriole is the branch of the interlobular artery, and this interlobular artery gave this branch efferent arteriole. This efferent arteriole goes and make a structure. Their structure is called glomerulus, and this glomerulus is in between the or inside the cup-shaped structure that is called Bowman capsule. This is the part of nephron, and this glomerulus further gave a branch outside. This is called efferent arteriole. This is called efferent arteriole, and this efferent arteriole goes and give some other branches divided into small branches that is not having the same diameter, but over here the diameter is shown the same, but this is not having the same diameter. These are actually capillaries. These are not arteriole. This is efferent arteriole. This is efferent arteriole. This is glomerulus. This is efferent arteriole, and these are the capillaries, and these capillaries are called peritubular capillaries. Peritubular capillaries, and these capillaries are all around all the tubules of the nephron. All around all the tubules of the nephron. These capillaries further goes and make venules. These capillaries goes and make venules, and these venules goes and make uh, some vein that is called arcuate vein. This is called arcuate vein, which drain blood from this area. I will explain the function of these capillaries, peritubular capillaries, and this arcuate vein uh, in the urine formation in that topic. So this is the arcuate vein. This arcuate vein goes further and give interlobar vein, and that interlobar vein goes further and make segmental vein, and that segmental vein goes further and make just like this one, just like the artery. Segmental vein further goes and make the renal vein, and that renal vein further goes and make this is the renal vein. This renal vein further goes and make descending aorta, and this descending aorta uh, goes in directly into right atrium of the heart through inferior vena cava. So this was all about the blood supply to the kidney, and nephron. In the last diagram, you can see that eventually this nephron is supplied with the blood. Eventually, this nephron is supplied with the blood. So this was all about, and you can also see that the capsule of this kidney, the capsule of this kidney is also supplied with the blood. It also need blood for its regular function, but the kidney need a lot of blood for its regular function, as well as for the synthesis, for the formation of urine. So the kidney require large amount of blood, and kidney is also, you can see over here that it is provided with large number of arteries and arterioles.